Yes, ready when you are.
Okay. All right. Good. And I see Brian and Cara here as well. So we will dive in one more moment here. Okay. Good afternoon, everyone. Thank you for joining us for Burlington's COVID-19 update for Friday, January 15th. We have a number of updates we want to share. So let's jump right in. We'll be hearing later from our Chief Innovation Officer, Brian Lowe, and Carl El-Nazraoui, who is our Chief Church Street Marketplace Director and Small Business Support, heading up our small business support effort through this emergency. And she'll be here to give an update on the city's ventilation effort. We're going to start like we normally do, looking at the dashboard, which is always available for anyone who wants to see it on the city's webpage. Focuses in particular on Chittenden County data. And you can see that the picture of Chittenden County since early November has really steadily, we have seen a climb in the total number of infections on a daily basis. Generally, we've had a little, some dips in there, but that might be the data as much as anything. Generally, we've been on a steady climb since November after a long period with virtually no virus circulating in the county. We are up now to over 50 cases a day on a 7-day average. Further, also a cause for concern is we continue to follow the news around the world of the impact that these new variants of the virus are having on infection rates, and we remain concerned that that could be a cause of further spikes. And in fact, the governor, for a variety of reasons, has told us that we should expect to see continued growth in cases in the weeks ahead. At the same time, we are in a period that offers real hope. Many of our most vulnerable residents have received the vaccine in phase 1A, and many more will be receiving it soon when the state begins its next phase of the vaccination effort, which, as the governor announced earlier today, is going to begin the week of January 25th. So we're in this period where there's both this elevated and growing risk, and when we really can start to see how this thing is going to end, and how the end is in sight, especially for our most vulnerable residents. And we know that older Vermonters and Vermonters that have chronic health conditions are far more susceptible to mortality risk than others. So it is very exciting that we are getting to this stage of the rollout. It also I think it means that the stakes remain very high right now. If we are able to postpone infections for just a matter of a few more weeks, that may make the difference between life and death for some of our loved ones and neighbors. So we here in the city of Burlington, and I encourage all Burlingtonians to remain vigilant through this critical period. So to that end, there are three main updates I want to provide today. We are excited to announce that we have started a testing protocol through our wastewater to test for the new variant of COVID-19. And we're going to talk about that. That's something we've just started, and just in fact, within the last hour, have gotten back our first test results on. And I will share here that, well, let me save it for there so we get the full context around that testing, and we're going to go to that in a moment. We're also going to talk about how the city understands and is working to support the state's vaccination plans. And we are going to touch on the upcoming return of college students. So we'll have more to say about that as the restart of college classes gets closer, and that both Champlain College and the University of Vermont will be restarting classes at the beginning of February. We also, again, we'll have an update and actually some news to share of an expanded ventilation program at the end of the briefing. So with that, let's talk about the new variants of COVID. We showed on the briefing last week people who have been following this have seen this in many places, where the new variant of the virus is circulating widely. There are very dramatic spikes happening around the world, relative to comparable areas that do not see widespread numbers of the variant yet. In particular, Britain and South Africa have really seen what appears to be a dramatic change because of the new variant. So it's important to know if the variant is here or not. We said last week there has now been a confirmed case as close as Saratoga Springs, New York, or sorry, Saratoga, uh, Saratoga County, and we have to assume that could mean that it's here. Further, as there has been a fair amount of attention to in recent weeks, the country's protocols for detecting new variants of the virus are extremely limited. A very small number of the millions of tests that take place across the country at this point on a daily basis, a very small percentage get an additional scan. A genomic analysis is what it's referred to, where you really get into the understand what strain of the virus is present. So, given how limited our tools are, we've been working with a lab and looking into the possibility that this wastewater testing that we've been doing since August could be expanded to give us some picture as to whether the new variant was here as well. And in fact, that is what the lab we are working with is doing. This is a new strategy, and we're one of just the first cities in the country that is monitoring in this way. The hope is that this will give us a better idea of how the threat of the virus is evolving locally. Brian, do you want to share some more detail about how this new strategy evolved and what people should expect from it going forward?
Sure, Mayor. I'm happy to do that. Thank you. The way our wastewater testing works is we look within our wastewater for concentrations of viral RNA. And the lab that we're working with is able to assess whether or not the viral RNA that they identify in the city's wastewater has some of the changes that the variant the mayor is talking about here has at a cellular level. If some of those changes to, for example, the spike protein are present in our wastewater. They're able to do this with a very sensitive test that has a limit of detection in a community of our size of about a handful of people. And so a non-detect doesn't mean that it's not here definitively, but it means that if it is here, it's likely at a very, very low level. And Mayor, I don't know if you want to share kind of what we've learned so far.
Yeah, so I'm glad you described what a non-detect means, and that is, again, the results that we just got back earlier, I think a little over an hour ago, were a non-detect. There was, we do not have evidence at this point that the virus, this new variant, is circulating in Burlington at a measurable level. And that is reassuring. I think it's important that not me, again, we know that the virus has been detected near here, and there it is not completely definitive, this testing, but I think it is reassuring that it's unlikely that the recent case growth we've seen in the area is being really driven by that. I think it's reassuring from that perspective, and I think having this surveillance in place will give us the opportunity to monitor this more closely from here and raise concerns and potentially change protocols if this shifts in the weeks ahead.
Thanks, Mary. I think that's right. And I wonder, Olivia, I'm not sure if the next, we are working closely with the Department of Health on this, but I think this next slide also to try and reinforce the point that the mayor is making here about, there are limitations to what a non-detect means of the new variant, but also the prevailing trend in our wastewater is not, we are definitely trending in the wrong direction. And I wanted to speak quickly to this this slide and this graph because I think it's important to understand what's happening in terms of the prevalence of viral RNA in the city's wastewater, broadly speaking. This is a scale that shows 3 lines over time representing the city's 3 different wastewater treatment plants. The east plant in red, the main plant in green, and the north plant in blue. You can see dots here representing samples taken on particular days tied to those respective plants. And the colored lines represent the trend line. What's important to note on this scale, or on this graph, is that it's showing you data in a logarithmic scale. So the units on the y-axis are not increasing linearly. Those are increasing by order of magnitude, by a factor of 10. And so what looks like a fairly gentle upward slope for the main plant actually is indicative of significant growth over time in both the main and north plants. We've seen kind of a volatile east plant, but it's trending currently in a fairly stable direction, basically. But the north and main plant are seeing significant growth over time. And so from that perspective, certainly the state has been encouraging people to get tested if they're at gatherings outside of their household. And if that's true in the north and main plant areas, which really is the new North End, the old North End, and the downtown of Burlington, folks who have been at gatherings outside of their homes in recent weeks may really want to consider getting tested.
Good, Brian. And how frequently should people expect updated? Will we know every time we do have a round of testing? Will they be scanning for the new variant each time, or is this something we're doing on a weekly basis? How is that going to roll out?
Great question, Mayor. Thank you. I should have said that we are planning to test for the new variant twice a week going forward in our wastewater plants.
Great. All right. So again, to summarize, the city working with this lab, which we believe to be really on the cutting edge of this technology nationally. We're joining just a handful of other jurisdictions that are testing for the new variant on a regular basis. At this point, we have not detected the new variant. That's encouraging. Should not be understood to mean that there is no threat, no risk of the new variant, but it is an encouraging indication that it is not widespread at this point. We'll continue to share updates on this as we go forward from here.
I think that's great, Mayor. I just would add that the Department of Health has been very helpful as we go through this, as has Matt Dow and Nancy Stetson from the city team.
Great. Okay, let's talk about the next phase of the vaccine distribution plan. Earlier today, the state shared a lot more detail about what they are planning for that next phase, which, if people remember, phase 1 has really been focused on healthcare workers and residents and workers in long-term care facilities where we have seen so much tragedy and where there's clearly such vulnerability. The next phase will begin the week after next, so the week of January 25th. And in this phase, we really enter a new period where we're starting to have broad community vaccination, and it's going to require a whole different set of protocols and infrastructure than the first phase did. If we could advance, Olivia. So as we have, we've been in close conversation. I want residents of Burlington to know that Brian and I basically on at least a weekly basis have lengthy meetings with both Dr. Levine and representatives of the Agency of Human Services. And in recent weeks, our conversations have been largely focused on the vaccine and the vaccine distribution. And I want to start by saying, it is clear that this is a massive logistical undertaking that the state is responsible for here and is running. And we appreciate the challenge involved in getting this, and we appreciate the effort and the clear hard work that is going into this. In our conversations, we have been focused on several principles which we believe are going to be reflected in this plan as it is finalized and begins to be implemented. First, that the vaccine should be distributed fairly based on the size of the target population. And I think that there's some subtlety in that I think people should understand. The That means that doesn't mean we just divide this up straight by the size of the population, because the total population, because the target population for any given round of the um, of the any given phase of the vaccination effort may vary some from the sort of uh, total per capita division of the state. For example, Chittenden County has a lot of medical workers here and has gotten a disproportionate share in that sense of the vaccine in the early stages, because there are so many healthcare workers here in Chittenden County. On the other hand, we are a younger county than much of the state, so that may impact the pace at which there may be some shift in the other way direction as we go forward from here. But I think that principle of fairness based on the size of the target population is an important one and is part of their plans. Second, um, the clearly communication, education, and translation services need to be resourced and prioritized. We know here in Chittenden County, we are a very diverse community, and we know that we have struggled at times to communicate, before the pandemic, uh, uh, fully with all elements of our community. Um, this vaccine rollout is a matter of life and death, and the whole pandemic has been. We have set up substantial additional resources to be communicating with all elements of our community. We're positioned to really do that well during this vaccination period, and it needs to remain a priority, and it needs to be resourced. And again, we believe we have agreement on that principle as well. Third, vaccination needs to be accessible for all of our residents. And I'm particularly focused on the fact that on transportation with this principle. We know about 15% of Burlingtonians do not own cars, and there needs to be a plan either through walkable sites or free transit for um, residents that don't have cars to be able to access vaccination services right from the start. This can't be sort of an afterthought, something that comes later. Um, uh, Again, from our conversations um, with the state, we know that they are focused on these principles as well, and we are hopeful that the plan is going to be rolled out consistently with this. It's going to continue to be a focus of ours to confirm that is the way the vaccination efforts are implemented. It's again, as I said at the beginning, it's a huge undertaking and that the state is in the lead for. The city of Burlington has offered all possible assistance to supplement their efforts that we can, as we have throughout the pandemic. We certainly stand ready to help with the distribution of information to our residents, and as we have helped set up testing sites, pop-up testing sites, and other resources throughout the pandemic, we're ready to do so again if that's needed. Again, it's I appreciate the leadership the state is showing here, and I'm hopeful that, as with so many elements of this pandemic response, Vermont is going to lead the way and avoid some of the challenges and kind of nightmares that we've heard about taking place in other jurisdictions. Do you want to add anything to that, Brian?
Mayor, I think you said it well. I think that, I think you'll be quite clear if you find areas where we need to do more, and I look forward to working with you on that if that happens.
Exactly. Great. So now we're going to touch briefly on the return of college students. I do think in future press briefings we will have the University of Vermont and Champlain College back to talk about their plans more fully. But and again, that is several weeks away before colleges are in full swing. Right now, the University of Vermont and Champlain College are planning for the return of students. In fact, some students, particularly athletes, have begun returning already. to get ready for this. We've done this 2 other times, right? We had students returning to the area in June. Early in this pandemic, there was a much larger return of students in August, September for the beginning of the semester, and this is our third kind of major migration of students back to the area. I've talked personally this week with both President Garamella of UVM and President Akande of Champlain College, and confirmed that both are intending to reopen in-person learning in early February. They all are also aware that the risk levels, of course, are significantly different than when the last semester began. There are much higher levels of community infection, and they are both taking extra steps and are thinking about the challenge in a new way, given the heightened level of virus circulation. I think it's worth remembering that there was a lot of concern about the return in September, and we received assurances at the time that the colleges would work hard to keep the community safe and keep their students safe. And I think it's really worth repeating at this point that those efforts were successful. What happened here in Burlington stands in stark contrast to many communities across the country that are college towns, where you saw very high levels of infection rates within the student population, and that quickly spread to other more sensitive facilities in those communities. There's been a fair amount of reporting on that and that didn't happen here. In fact, the student populations were pretty consistently through the fall. They were testing at lower general infection rates than the surrounding population. So I think our institutional partners have shown they're committed to making this work, and they're committed to making it work again. We are going to continue these conversations, and we'll have more to share about it, about the extra planning efforts that are going on in the weeks ahead. Finally, let's move to the ventilation program. And again, I welcome Kara Al-Nazrawi. And last Wednesday, we announced a new program to buy HEPA filters and distribute them for free to qualified small businesses and nonprofits that are offering here in Burlington in-person services where different households are mixing and maybe indoors together at the same time. Those are areas of potential risk. We've had earlier ventilation programs that we think has had an impact on indoor space in Burlington, and we wanted to take another shot at it. And we put out a call for businesses and nonprofits that were interested in receiving in these essentially air purifiers. And there has been a big response to this. We are using $25,000 of city emergency funds to fund this program, and essentially in the first few days, I think, correct me if I'm wrong, Car, but I think we just lose track of the days sometimes, but I believe we just opened this program on Monday of this week. And here we are on Friday, and that program is fully subscribed. So we are expanding this with another $15,000 of emergency funds, and continuing to invite applications through the weekend. And I think Monday is when we are expecting to essentially close this round and do the assessments of where the highest impact, what are the spaces that are having the highest traffic, and where can these purifiers have the greatest impact. So we do encourage everyone that is interested to get your application in the next few days, and then we'll be pushing to get them out. And I think, Kara, do you want to discuss timing and what you've already done, the pace with which you think this equipment will be deployed?
Yeah, so thank you, Mayor. Yeah, we were really pleased with the response we've had so far. Again, that number of 50 applicants was as of this morning, so applications are still coming in. And as you indicated, we are expecting to be fully subscribed by the close of business on Monday, which is when this round closes. So we've had 50 applications in the first 4 days. 12% are from BIPOC-owned businesses, and we've been doing specific outreach to them, and we've been pleased with the response on that as well. Just making sure that we're getting out to everyone in the community that we can. We have ordered the first round of HEPA filters, and they should be arriving next week. And then we will try and do a very quick turnaround and get the distribution out the door. I'm hoping maybe end of next week, but right around there or a few days after that, and get these in people's hands. As you had said, these are for high traffic areas where multiple members of different households are potentially coming into contact on a daily basis. This is an attempt to, from a business perspective, to keep our businesses open and safe, and making sure that everyone knows that they can still come out if they choose to. And I can only say that we're really pleased with the initial response for this, and keeping all of our public spaces and spaces where commerce is happening as treated and clean as possible.
Great, thank you, Cara.
Thank you.
I think that is the full briefing for today, and we'd now be happy to take questions if there are any.
Great. Reminder for members of the media, you can let me know that you'd like to get in the queue by sending me an email. And I do see a number of members of the media here, but I don't have anyone in the queue at the moment. So let's see, we can give it another moment and see if anyone has any questions. Mayor, I don't know if there's anything else on your mind while we give folks a moment to get their questions in.
Is there anything else on my mind? I think we've covered, Olivia, what we had planned to, and certainly we see. I do see Seamus has his hand up, so maybe we can let him in, Olivia.
Great. And Seamus, I just saw you emailed me as well. One moment. All right, Seamus, you should be able to enable your microphone now.
Great. Thank you, Olivia. Sorry, I was a little late getting that to you, and I appreciate Mr. Mayor staying available for questions. I wanted to, you did mention wanting to comment a little bit more on the college reopening in the following weeks. I was wondering, though, at least for the time being, do you have any specific message that you'd like to underscore regarding probably especially the students that will be supposedly quarantining off campus as opposed to the ones required on campus? These people more likely to be interacting with their neighbors around Burlington off the campus itself.
Well, I think what I would like to share with residents at this point, Seamus, is that I and the leadership of the colleges are certainly very aware that while Vermont continues on a relative basis to do quite a bit better in terms of virus suppression than basically the rest of the country, nonetheless, there is an elevated level of risk now versus when the colleges restarted in the fall. And because of that, we are no one is assuming that the success of the fall is just going to be repeated just by doing the same things as we did last time. I think we need an additional layer of vigilance and awareness, and there may be a need to take steps that go beyond what the colleges, the very robust steps that took place last fall. And I have heard from both of the presidents that that's the way they're thinking about this. They do want to proceed, and frankly, I think they've earned our confidence in proceeding given their performances in the fall. But so they're going to, at this point, unless something changes, that is the plan, is they are going to attempt this. And I think we should give them that opportunity. I also think we need to, because we are in different circumstances, be watching very carefully, and that's what the city intends to do. And I'm been reassured by the statements and the planning that we've seen from the colleges that that's the way they're approaching it as well. In terms of off-campus students, I mean, I do think it has to be said. I think we should, students' behavior in this community is often criticized, sometimes very appropriately. I think it should be noted and acknowledged that the colleges demanded that their students meet high standards in the fall, and they took action when they saw when they needed to, and most of the time they didn't need to. There was a very high level of compliance with the rules, and I appreciate that, and I think given that. I think it's incumbent on us to acknowledge that they did a good job. Let's hope they can repeat it, and we appreciate that they, like so many people in this community, took responsibility and helped produce these really exceptional results in the fall. Let's do it again.
Just one more question. This wastewater treatment procedure, I mean, this sounds exciting and will probably allay some of the concerns that other local officials had about such a low number of tests being sent from Vermont to the CDC for genomic sequencing. Are you aware of other places, other cities that are doing this? You mentioned that Burlington was one of the first. And if you could also name the laboratory that you'll be partnering with to process.
Right. Yeah, Brian, why don't you speak to that? I think you have a little bit more information on both those fronts.
Sure, thanks, Seamus. The name of the laboratory that we work with is called GT Molecular. We work with them through the main vendor that we work with, who's helping us test our wastewater, which is a company called GoAgua. GoAgua is based out of Spain and New York. GT Molecular is a lab in Colorado, an outgrowth of Stanford University. I didn't hear the beginning of your question, though. You're saying what other cities are doing this test?
Brian, I think you told me that that there were a couple other communities in Florida that this lab is working with, and that's what Seamus was asking if we knew what other jurisdictions or cities were using this at this point.
Yeah, I do not have a comprehensive list. I know that there are other communities that are using it, several in Florida, I believe one in Connecticut.
Great. Well, thank you, Brian, and thank you, Mayor.
Sure. Great. Thank you.
Next up is Catherine from WCAX. Catherine, you should be able to enable your microphone now.
Hi, can you hear me?
Yes, go ahead, Catherine.
Great. Thanks so much for taking my question, Mayor, and thanks, Olivia. I was just wondering if the new variant of COVID is identified in the wastewater testing. I mean, what greater precautions are you going to be taking? Or is there anything you're going to enact, or is it kind of just business as usual, masking up, staying away, staying in our own households and stuff like that?
Thanks, Catherine, and it's the right question, and it's, I think, a question that's being asked around the world. You have seen governments in other parts of the world. I mean, Britain, when they took significant steps when they were aware that that this variant was circulating widely. There was additional, essentially, shutdown steps, or also neighboring countries that took action. So I don't want to speculate about what would happen here, and I think certainly we're aware that we're already calling on residents for a high level of compliance already. We did recommend last week that one thing that people could do that we do recommend that has not gotten a lot of attention up until now is to think about the quality of the mask that they are using. There's increased discussion that mask quality can make an impact. So that is one thing in terms of currently that we're already saying in terms of heightened vigilance that we would encourage people to think about. If you have a choice between these thicker cloth masks that seal more tightly around your face versus lycra masks or some of these other less robust technologies. We recommend going with a better mask at this point. In terms, as I think has been a good practice by many government, certainly by the state throughout this, we don't want to prematurely speculate, but it certainly, if we became aware that there was widespread elements of this variant circulating, and that was driving new infections, I think that certainly further actions could be considered. Let's hope it doesn't get to that. Do you want to add anything to that, Brent?
No, Mayor, I think that's right. And I think part of the value of the wastewater monitoring system is that it should serve ideally as an early warning system in general. And then that same principle applies here with the new variant, in that it should be able to give us an early indication of if we do face that risk at a significant level.
Thank you so much.
Great, thank you.
Great, and that is all the questions we have for today.
All right, great. Thank you, everyone. I appreciate you tuning in. Have a good weekend. Stay safe, and we will talk to you again soon. Thank you, Brian and Kara. Take care.
Thank you.